Hello and welcome to Health, Wealth and Happiness. I am your host, Dr. Sadiq. As you know that winter is coming, it's almost there, and we have a lot of weather changes, and it is making people bringing a lot of sickness. I have a guest with me today, Amy Munro, and we are going to talk about asthma today. Welcome, Amy.
Thank
How
you.
are you doing
Very
today?
well, thank you.
So tell us something about asthma. What is asthma?
Asthma is a disease of your airways. People can't get air in and out, and it makes it very difficult for them to breathe. They wheeze, they cough.
So what brings asthma?
Bronchospasm
Spasm, yeah.
of the airways. Mucus can be produced. How does it happen? We don't really know. We don't know what the cause is. There's triggers. Pollens can trigger it. Dogs, animals can trigger it. But it's constriction of the airways, and then they can't breathe.
I think I've seen a lot of people, like children, are getting this attacks which are very life-threatening. And,
Yes.
and what happened? The cold air can actually bring asthma. As the audience knows that what happened in our airways, there are muscles in our airways. There are pipes, and with the cold air, even with the stress, those pipes become tight, and when they are tight, they are actually really people are having hard time breathing. So I think just to in a simple words, if we have a tight airways, the breathing is difficult, and as Amy said that you will have cough, one can have breathing problems like wheezing, and a lot of mucus will be there, and that precipitate even more symptoms of increased shortness of breath. You think that is it more common in a specific gender, or it's
I think it's across the board. And if you look at numbers, it is more common in boys than girls, but it's more common in women as you get older.
okay.
But it's across the board.
It has anything to do with age?
You usually do get it when you are younger. You'll start to have the
Oh.
symptoms, but you can get it at any age.
So maybe we can tell the audience that if they are having pet and they get the symptoms, or if maybe they are allergic to pets,
Right.
they're they have to be very careful.
Right.
Um,
I mean, asthma can be just, we really don't know the triggers, but you could have an underlying asthma that's only triggered by a pollen, by an allergen. And if you unfortunately, once you find out, if you get rid of that pet or that allergen, the symptoms do go away.
Absolutely. So we have to be really careful.
Right.
And what do you think that if a person is having first-time symptoms, should they just go and look for over-the-counter, or what would you advise people to do that?
Don't use over-the-counter. I advise people to call their doctor. There is a test most people can do in their office to determine, is this asthma or is it something else? There's very good treatment now, very safe treatment, both rescue and maintenance therapy if needed. So definitely call your doctor. Do not treat over-the-counter.
So as Amy said, definitely call your doctor and just follow the advice. As you know, maybe it was asthma, maybe it is something else. So we have certain tests which we do. We call it pulmonary function test, or the other name is spirometry. So that way they actually can be done in the offices. So that way they will find out whether you really do have asthma or you do have some other kind of disease. So talking to your doctor is very, very important.
Yes.
Anything which can help the people who have asthma and diagnosed with asthma, anything which can reduce the risk of getting asthma?
The risk of getting an attack?
Attack.
Okay. Obviously, avoiding your allergens, avoiding the triggers, avoiding smoke or cold. A lot of people just have an asthma attack or bronchospasm when they go out in the cold, wearing a scarf over their face or avoiding the cold in general. If they are on inhalers, using their rescue inhaler prior to exercise. Just finding what is their trigger and how they can avoid it.
I think this is very important point which you just mentioned, and I want to actually reiterate again one more time that if you are going for exercise, and sometimes this asthma is actually exercise induced, right?
Mm-hmm.
And you have to be ready for that. Have the inhaler in the pocket, and
Yes.
before it gets worsen.
Yes.
So is the weight has anything to do with it?
Yeah, the people that are overweight, people with asthma, oh, I don't know how to put it. More people that are overweight have asthma than that are not overweight.
So it means weight does have
It does
anything
have
to
an
do.
impact, yes.
So it may be our body habitus is such that it may be our lungs are on a smaller proportion compared to our
To
big
what we
body,
need, right.
body habitus. That
Right.
might be a reason.
Yep. And people that have asthma then are worried about exercise. Am I going to have an attack? And they do have to be cautious. And like you said, carry their inhaler. But they need to exercise. Do it at lower impact. Do it, build it up. Do a nice warm up. Don't just go in and try and run a marathon, because they probably won't be successful.
So cold air, we have discussed. We have discussed the overweight, and also stress related, and pets.
Yeah.
So we do sometimes we don't know what the causes are, but at times we find out what the causes are. So if you find out what the causes are, then please work around it. If you have noticed that going out in cold air is bringing the attack, so you have to avoid it. If you think pets are doing it, their hair, the cats and the dogs, you have to avoid that. If you think stress related, sometime if you are under stress and you are thinking that it's bringing the attack, so you have to address your stress. So how about any pain medications which can also precipitate the asthma attack?
So aspirin and anti-inflammatories like ibuprofen, Motrin, a lot of people have a sensitivity to them or an allergy to them. So if you find yourself after taking medication like that some of your symptoms worsen, you may have that sensitivity, and you can check with your doctor.
Okay, that's a very, very important point. Like aspirin is so simple, everybody takes it,
Yep.
and people don't realize that this can be a problematic.
Yep.
So I think it's very, very important to actually keep an eye on your medication list.
Absolutely.
Is pregnancy has anything to do with asthma?
Well, if you already have asthma, it can worsen your, but it's more taxing on your body. You're building another human being there. So people can have worsening of their asthma. It is very important to maintain your medications. A lot of people don't want to take medications when they're pregnant, but the risk of not is more dangerous to you and your baby than taking them.
So it is safe for the pregnant women to take those inhalers which doctor prescribed?
Absolutely.
Okay, so I think that's very important point for the audience to know that. Talk to your doctor again and see that if the pregnancy it's safe, the inhaler which you are using is safe, but please make sure that you are getting appropriate treatment during your pregnancy.
Yes.
So anything else you want to add to the asthma medication? What kind of inhalers we should be using? There are different type of inhalers.
Yep. So there's pills and there's inhalers. Sometimes people, especially young kids, especially if it's exercise induced, they can get away with just an oral medication. And then a rescue inhaler. Everybody that's diagnosed with asthma has to have a rescue inhaler. You encourage them not to use it. If they're using it, it's the rules of 2. If you use it more than 2 puffs more than 2 times a week, or you go through more than 2 inhalers a year, your asthma is not under control. So you give it to them, but you make sure they're not refilling it over and over again. If you find yourself filling it monthly, you got to bring them in and talk to them. And then there's your inhaled steroids, which many people do need for maintenance. They're not very systemically absorbed, so as we said before, with pregnancy, they are safe. But you hope that, again, they don't need those forever either.
So going back to your inhaler, certain inhalers, they actually make the pipes bigger. Right, so we have to have that all the time.
Correct.
In
Those
our
are maintenance.
pocket, because they're a quick fix. They can actually make our air pipe bigger and we breathe better. Then certain types of inhaler, as you said, are steroids. It reduces the inflammation.
Right.
The asthma actually is an inflammatory process. Our our pipe gets like inflamed, sore, in other words. So we have to reduce the soreness or inflammation. So steroids does reduce the inflammation, as Amy said. We have to, if we are using those, we call it bronchodilators. They dilate, they make the pipes bigger. If we are using those inhalers very frequently, it means that we have to reduce the inflammation with another medications, and that can be steroids. That can be another inhaler we call ipratropium. That can be actually also reduce the inflammatory cells, and that also reduce that makes when we will reduce the inflammation, the pipe become bigger.
Mm-hmm.
So we have certain medications in our access where actually we can reduce the inflammation, we can reduce the swelling of the pipe, so that our pipes are bigger and we breathe better, and that way we will have less cough.
Yep.
And less wheezing. So we can you tell the audience that if those inhalers, sometimes we use the inhaler but we don't know how to use it.
Mm-hmm.
So maybe they can go to the provider and the doctor and.
Yep. So there's so many inhalers now, so many different devices. Some are the normal meter dose inhalers that you see everybody. They shake them and they have to push them and coordinate the breathing. Now there's dry powder. Some are only once a day, some are twice a day. So there's a lot of options. But if you don't understand your inhaler, you come to your provider. If they're not available, it's a weekend, go to your pharmacist. There's people out there that can help you. But you need to take them correctly, because if you don't get the deposition in your lungs, it's not going to work.
So my father was using an inhaler and he did not know how to use it. So he will just put pop. Dad, this is not the way you should use it.
Yeah.
So I think we have to learn the right way. So if you are not taking the medicine in, it's just staying actually in your mouth.
Correct.
And especially steroids inhaler. If you're using steroid inhaler, you have to wash, you have to rinse your mouth after steroids inhaler, because steroids can cause a mouth fungal infection in the mouth. So we have to really rinse it well.
Yes.
So I think we have pretty much overview, quick asthma review. I hope that our audience enjoyed today's show. We will come back after the break. Welcome back. Again, our guest today is Amy Munro, and I'm going to talk to her one more time about pets. Sometimes people love, not sometimes, all the time people love their pets. And if they find out that there's a problem, I think Amy can help us, whether there are some treatment or there are some tips to the audience that they can still have their pets.
Absolutely. It depends on how bad you're allergic, but you certainly can do some things in your home, not let your pets on your furniture, not let your pets in your bedroom. There are allergy covers that you can put on. There are things that you can do to prevent that transmission of the dander and all of that. But just being compliant with your treatment. If you take your medications and you follow the rules of avoiding as many triggers as you can very happily have your pets. Some people need allergy shots. Allergists are available for that, but there are many options to maintain happy pets.
So if you want to stay happy and want to keep your pets, follow the instruction from Amy. So suppose that some people get really bad attack, what would you advise them?
So if they're having a bad asthma attack that's not relieved by their inhaler, and they have a nebulizer at home, that's another device. It's a machine that turns the albuterol that's in an inhaler into more of a fine mist. If they do that, they can try that, because that's much smaller droplets. It gets into the lungs much easier. And so that's a rescue, a super strong rescue. If that doesn't work and they're still very short of breath, they do need to go to either the doctor or the emergency room for treatment. They may need oxygen. They may need some other medication through an IV to get them out.
Sometimes they get the superimposed bronchitis with
they
that.
could be sick with
and
it.
I think you mentioned earlier about the smoking. So I would suggest that to the audience that if anybody at home smokes, so you have to be careful that
Absolutely.
you have to avoid this secondhand smoke, or also if you smoke, then you have to quit smoking. It's bad for the asthma, right?
Correct. Yes.
So I think our tips to people who really wants to have pets and who really want to be healthy, they have to actually follow the instruction from their doctor. They have to be compliant with medications. I think today I hope that you enjoyed the show today. We are actually will end our show today here. We'll thank you very much for watching Health, Wealth and Happiness. Until the next episode, keep yourself safe, healthy and happy. Thank you. Thank you, Amy, for being on our show today.
Yep.
And thank you for watching our show. I hope that you enjoyed our today's episode. Until next time, stay healthy, be happy, and live better. Thank you so much.